Priority question number 1 is in the name of Deputy James Brown. Deputy Brown to introduce.
I asked the Minister for Health if, in view of recent events, he has plans to review the arrangements for the funding and auditing of Section 38 agencies, and if he will make a statement on the matter.
Minister.
Thank you, Gael. I want to thank Deputy Brown for this a very important and timely question in light of a number of public concerns that have been raised in relation to organisations funded by the Health Service Executive. And I want to inform the Deputy and indeed inform the House this afternoon, as the Taoiseach did a few moments ago, that a review of all Section 38 providers is now being conducted by external consultants, and this review is now underway. The purpose of these reviews is to build, I suppose, on some of the measures that were previously put in place in recent years, and is to establish the standard of governance in place in these organisations, and to confirm independently that the governance practices and procedures accord with those set out in the respective annual compliance statements of those agencies. These reviews will involve an examination of key governance processes and documents, including obtaining confirmation that internal financial controls and that formal written financial procedures are in place in these organisations. 6 of the reviews, Deputy, are currently already underway, and the outcome of these reviews will inform both the HSE's relationship with the agency concerned, and indeed any further enhancement that might be required in relation to the HSE's overall governance framework, as you're asking me about this afternoon. As you know, the HSE is funding about 40 agencies under Section 38 of the Health Act, and also providing funding to a much wider group, grant aiding a much wider group of what we know as Section 39 agencies. The size of the 40 agencies delivering services range significantly in size, from the Daughters of Charity, with an annual budget of just over €2 million, to St James's Hospital with a budget of almost €357 million. I think it is important to say that Section 38 agencies have played a very important role in the development of our health and social care services, and some agencies delivering services under Section 38 arrangements are amongst the very best that we have, both in terms of quality of care provided and also in terms of systems of governance employed. However, there is an absolute requirement for all agencies to continually review their governance process in order to ensure they are sufficiently robust. The HSE has in recent years taken significant steps to enhance its system for performance oversight of Section 38 agencies, but I do believe these new additional measures, the external review, the independent oversight, is essential and welcome.
Deputy Brown.
Minister, you'll be aware there's recent outrage over top-ups to executive salaries at St John of God, and the revelation, of course, coincides with news about cutbacks in St John of God services. The HSE has said it does not consider the St John of God organisation to be compliant with public pay policy, in light of recent disclosures about the remuneration of senior staff. Yet I also understand from newspaper reports that talks are understood to be underway, which may see a number of senior personnel in the National Maternity Hospital being permitted to retain higher salaries. And the question has to be asked, how does the Minister reconcile these reports with the reports concerning St John of God? And I would ask, can the Minister identify in particular which, if any, Section 38 organisations are believed to be not complying with government pay policy? Is the Minister satisfied with the level of policing of pay policy in relation to Section 38 organisations in wake of the top-up scandals? And is he satisfied that all the government requirements are being met by Section 38 organisations?
Thank you very much, Deputy Brown.
Deputy, in relation to St John of God's, I too am very concerned as to what I'm seeing, and that is why there is an investigation now underway by the HSE in relation to those payments. And I've been very clear, the HSE has been very clear, and today the Minister for Public Expenditure and Reform has been very clear that if any payments have been made above and beyond what is the allowable level of payment, those payments must be returned. You cannot have a situation where some people working in St John of God's earning much lower salaries than the CEO are subjected to the FEMPI Act, where people at the very top earning very large salaries aren't. That's simply not fair, and it's not in accordance with the rules. So that investigation is ongoing. But it's not just about whether I can guarantee you or whether I can be assured. It's about have we got the structures in place so that we can have a degree of certainty. And that's why I'm not satisfied that we just have an internal HSE review. I want to bring in the external layer. I want to have independent external consultants go in and examine all Section 38s. Make sure that they're all not just signing on the dotted line to say they're in compliance, but that they're actually in compliance. And I think that body of learning will really help inform if there's more steps that we need to take above and beyond what we're doing.
Deputy Brown.
Thank you, Minister. I welcome that there will be an investigation into this matter, and I welcome the confirmation that if there has been any overpayments, they will have to be returned. I think there is a level of disquietness that there isn't a certainty at the moment whether or not other overpayments have been made, and people will be disconcerted that this specific answer can't be questioned. I do welcome the announcement that there is a review, and I would ask the Minister that on the basis of this review that it be carried out as quickly as possible, and that any recommendations coming out will be implemented as quickly as possible so that we can ensure that this kind of situation of overpayments does not occur again. Thank you, Councillor.
Minister.
Yeah, I agree with the Deputy. I mean, I sat on the Public Accounts Committee when we were discussing this issue, I think back in 2013, and I, like so many people in this House and all sides of the House, was repulsed by the carry-on. A number of measures have been taken, in fairness, both in terms of the charity regulator, in fairness to the HSE and new structures that they have in place, but clearly there's more that needs to be done. And what I don't want to see happen, and I know no member of this House wants to see happen, is see that voluntary sector damaged by bad practice, because some of the best examples of high governance are present in the Section 38s. Some of the examples of best care are evident in some of our Section 38s. But if there's any bad behaviour or any wrongdoing, that needs to be weeded out, and it needs to be weeded out as quickly as possible. I absolutely will act on any recommendations. As I've said already, 6 of the reviews are underway out of the 40, but every single Section 38 will be subject to this external review. That's about 40 agencies. I think that's appropriate. I think it can give all of us a reassurance, but most importantly, it can give the service users, often vulnerable people who depend on these services, the level of reassurance that they deserve.
Thank you, Minister. Second question is in the name of Deputy Alan Kelly. Deputy Kelly, for 30 seconds to introduce.
Minister, as Vice Chair of the PAC, I've just left my office after reading some very concerning documentation in relation to the HSE and Section 39 organisation, which we'll be discussing on Friday in the PAC. There's a crisis, Minister, in relation to transparency of funding of organisations under Section 38 and 39. And I listened to your response to Deputy Brown, and I listened to the Taoiseach's response earlier on to my own party leader. And to be honest with you, in relation to these issues, they didn't fill me with confidence. So I'd ask, in the spirit of transparency, Minister, if you will publish the audits of all of the Section 38 organisations, and if you will consider pro tem putting a representative of the HSE on the board, or ask to do so on the board of each of the organisations, to ensure public confidence in the spending of money.
Thanks very much, Ken Corla, and I want to congratulate Deputy Kelly on his election as Vice Chair of the PAC. A fine body that I sat on before, and I know you'll have an interesting day on Friday, and I too have read the same documentation that you've read in relation to the said organisation, and it is indeed very disturbing and disgusting in parts. I have received a breakdown, in accordance with your question, of the funding received by the 40 Section 38 agencies from the HSE, and I'll supply this information to you today in tabular format. It wouldn't be possible to read it all into the record of the House, but the total funding to these agencies in 2013, 2014 and 2015 respectively is 2.735 billion, 2.747 billion and 2.883 billion. Annual grants, as I said to Deputy Brown, range from 2.05 million per annum for the Daughters of Charity and 356.87 million for St James's Hospital. Financial and performance oversights of agencies funded under Section 38 and Section 39 of the Health Act are obviously the responsibility of the HSE under its establishing legislation. The HSE has a formal national governance framework in place within which such funding relationships are managed. As part of its governance framework, the HSE requires that all grant-aided non-statutory agencies submit their annual audit accounts to the HSE. Furthermore, as part of its annual audit plans, the Internal Audit Division of the HSE conducts audits of a number of agencies such year, and several audits are currently in progress. And in fact, the documentation, I suppose, that you're reading currently and that has been in the media was a subject of one such HSE internal audit. Such audits generally focus on the systems of internal controls operated by the funded agencies and compliance with the HSE service level agreement. In addition, a number of internal audits have been conducted into the HSE's own management processes and controls over the funding and monitoring of services provided by the non-statutory agency. When these internal audit reports have been fully concluded, they are sent to the Controller and Auditor General and are also routinely issued under the Freedom of Information legislation. I want to look at doing what Deputy Kelly is calling on me to do and publishing all of them. What I don't want to do is have an inadvertent delay in finalising an audit because it then is automatically published. But I do want to work with you to try and get this done. And as I've already outlined to Deputy Brown, and as the Tánaiste has outlined, it's not good enough just that we have an internal look. We need to have an external look and see how many lessons have been learned, how many recommendations have been made, and that's why we brought in external consultants.
Thank you, Minister, for your reply, and I look forward to the provision of the documentation. While I have you, I asked a number of questions in relation to the estimates process. I still, a number of weeks later, haven't received any responses in relation to those questions, quite a considerable amount of them. So hopefully this question will be answered in the timeline you said. In relation to this topic has huge public concern, Minister, and you haven't answered the question which I asked, which is this. The public are very concerned about this issue. Everybody in this House is quite aware that the public are very concerned, and rightly, about this issue. And if an organisation like Console can get away with what they have, given the volume of funding that they received, look at the volume of funding that many of these other organisations are receiving. It's incredible, and they do fantastic work. But we need to ensure there is public confidence. I am happy that you are saying that the audits will all be published as quickly as possible. But pro tem, because you said earlier on, and I don't want to misquote you in response to a question, you want to ensure that there are established practices of governance in there. That doesn't fill me with confidence that the practices that are in place already work. So can we ensure somebody is put on the boards of all of these 40 organisations, pro tem, or have some form of relationship to ensure
Time is
public
up,
confidence?
Deputy Kelly now. Thanks. Minister.
Yeah, whilst I'm endeavouring to fill you with confidence, what we want to be very careful we don't do is fill the Irish people with a lack of confidence in some of the best service providers that we have in this country in relation to the delivery of healthcare. Some of the Section 38 organisations that we have, in fact, I'd suggest many of them are operating to the highest governance standards, as you'd agree, and are delivering absolutely vital health services that, quite frankly, were never delivered by this stage. And if they weren't there, God knows what sort of situation vulnerable people in this country would have found themselves in. What we need to do is weed out the bad apples. We need to find the people who aren't actually living in compliance, aren't living within the rules that they're meant to be. That's why we have an annual compliance statement. What's particularly upsetting and disturbing now, though, is that clearly we're seeing people in some cases are signing on the dotted line to say, yes, I am in compliance. Yes, I am living within the pay structures, and then simply aren't. That's the purpose of the external review. That's the purpose of the internal audit. That's the role of sending the internal audits to the CNAG. I want to answer your question there about the pro temp. I've looked at this. I don't think it works, and here's why I don't think it works. When I was on the Public Accounts Committee, we had the DDDA in, and we had that whole debacle. The Department of the Environment had a representative on the board of the DDDA. We had the Red Cross in. The Department of Defence had a representative on the board of the Red Cross. And what happened was roles and responsibilities got extraordinarily confused, and I do think there's inadvertent consequences. Who is the person responsible to the board or the HSE? So I'd rather beef up these controls first.
Thank you very much. Question number 5. 5 is in the name of Deputy Jack Chambers.
Thanks, Cian Corlett. I'd like to ask the Minister for Health the criteria for appointment to senior hospital management positions and board appointments in each of the hospital groups. What is the process, Minister? Are all the senior executive positions within the groups publicly advertised with interviews, and are all board appointments to these hospital groups publicly advertised for? Thank you.
Thank you, Minister.
I want to thank Deputy Chambers for his question. As I've stated previously, I intend to continue to implement the hospital group structures, but I intend to do so on an administrative basis. And the reason I'm doing that is because I asked this House to establish an Oireachtas all-party committee to develop a single long-term vision for healthcare over a 10-year period. It's very important that these discussions are progressed before I give further consideration to the issue of establishing hospital groups on a legislative basis. I think it would be disingenuous to move ahead with that while that committee is doing the work. In relation to senior hospital management positions, the HSE has developed eligibility criteria for senior management posts at hospital group and at individual HSE hospital level. The criteria reflect the particular experience, knowledge and qualifications required for specific posts and public sector recruitment policies applying to the filling of such posts. In relation to the hospital group board appointments, chairs, as the Deputy knows, are in place for all hospital groups, and board members were appointed to 3 out of the 7 hospital groups: the Sálta University Healthcare Group, the UL Hospital Group and the Children's Children's Hospital Group. The terms of office of the Sálta University Healthcare Group and the UL Hospital Group boards are shortly due to expire. Given the scale of the change process involved in implementing hospital groups, the hospital group boards must be populated with individuals with the expertise and competencies necessary to deliver on the strategic and change management agenda. My department will shortly advertise through the public appointment service process for nominees to all of the hospital group boards, excluding the Children's Hospital Group, and I expect to be in a position to fully populate all of those boards in the autumn, around the end of September. All of those boards' appointments will be done through the public appointment service. I think that's very important that they're done in that way in relation to transparency. I do think there's benefit in populating the boards, even on an administrative basis. I think there's a body of work that can be done in terms of strategic planning for the hospital groups, and I do think that efforts could, that the areas could benefit from that. So I do intend to populate them, and I do intend to use the public appointment service.
Thank you, Minister. Deputy Chambers.
Thank you, Minister. I asked you about the process of appointments, and you outlined eligibility criteria, but you didn't give to me a transparent process and how it's outlined. And I think what we're seeing within hospital management is a complete replication of the same management who were in hospitals to senior executive and chief executive management positions within the hospital groups. And let me give examples. We've one CEO of a group was a CEO of a main hospital, then they became an executive of the HSE, and then guess what? They became the chief executive officer of the group. Another was a director of nursing at one large hospital, became the acting CEO of a hospital, then became the de facto CEO of the hospital, and is now CEO of the hospital group. Another was deputy CEO of a hospital, then they became CEO of another hospital, and guess what, Count Corla? They're now CEO of a hospital group. Where is the transparency around the appointments to these hospital groups? It's a very important process of reform, and apart from mentioning eligibility criteria, you have not outlined, Minister, how your government or the previous government delivered a transparent process of recruitment within the managerial side of our hospital groups, and I think you need to clarify the matter.
Thank you, Deputy Minister.
Yeah, thank you, Count Corla. Deputy, I'm accountable to this House for the decisions that I've made in my time as Minister for Health, and that's what I was endeavouring to do in my outline, in my initial answer to your question, outlining to you my philosophy and my principled objective in terms of how I intend to populate the hospital group boards, which aren't currently populated. And I want to assure this House and assure you that nobody will sit on a hospital group board, or nobody will be appointed to a hospital group board by me who has not come through the public appointment system. I think that's important. You are, though, I think you raise a very valid point, actually, though, in relation to the appointment of senior hospital positions. And as you're probably aware of the history, there was a government decision back on the 14th of May 2013 in relation to the reorganisation of public hospitals into hospital groups, and sanction of that was conveyed to the HSE in July 2013, and as you are aware, there was an urgent request from the HSE in August of 2014 to reassign senior managers from within the health service to the hospital group CEO posts, and that was done on the grounds of exceptional circumstances and with the agreement of the Department of Public Expenditure and Reform. It was also done on the basis, considering the financial situation the country found itself in, that these proposals would not result in any additional senior posts within the health service. The department also agreed that the individuals will be assigned to these posts for a period of up to 24 months in this first instance. So this issue will be arising again, and it will be up to me to develop policy in terms of how we want to go forward.
The issue, Minister, is you've mentioned exceptional circumstances, but the issue is that those same chief executives have moved into as chief executives of the groups. Then their positions within the hospitals have to be filled, so a hospital senior executive manager has to move from another place. And I think what we're seeing here in our health service is a de facto locum system for managers. It's a managerial merry-go-round, it's a cosy cartel, it's insiders in senior executive hospital positions moving around, rotating around, and if we ran our hospitals as the managers are moving around, would be in complete chaos. It's the equivalent of consultants rotating around to different hospitals every year, senior clinicians, and they can't implement change management. And what we have is a system of managers changing, but no strategic change within our health service. And I'd urge you to investigate and explore the actual rotation of managers within senior executive positions in our health service. It's not transparent, despite the exceptional circumstances, and I don't accept the point around the eligibility criteria. And I urge you to deal with this matter soon, Minister.
Thank you, Deputy Chambers. I I take the point you make, and I would also reiterate the point that I made, that these appointments were made for a 24-month period. So we didn't have a scenario whereby people were sanctioned forevermore or for the rest of their career. These were appointments made initially for 24 months, considering what the then government decided was the particular and extraordinary circumstances in trying to get these hospital groups up and running. There is a serious issue, though, in the Irish Health Service in terms of making sure that we can attract and retain the appropriate level of management and indeed the appropriate level of clinician that we want. And I think this is something that I would really appreciate if the Oireachtas cross-party group on the 10-year plan is going to look at. If we want people to manage, I'm meeting hospital managers now and hospital group CEOs, and I'm looking into the whites of their eye and say, I need you to live within your budget. I need you to do this in relation to patient safety. I need to know that we have the calibre of people that is necessary to have, and I don't mean this in any disrespectful way to the people currently doing their jobs, but you will be aware that there was even difficulty in managing to find people to apply for the posts, and certainly in finding anybody to agree to take up the post. So these were the circumstances in which these individuals stepped up to the plate and are doing their very best and in many cases doing a good job. But it's for a 24-month period and it will be reviewed then.
Thank you very much. Before moving on to ordinary questions, I wish to advise the House that 40 deputies have submitted matters
Minister for Health.
Moynihan to introduce.
Minister, people in Cork are enduring the longest and the slowest waiting list for gynaecological services in CUMH. It needs to be dealt with. At the moment, there are over 3,858 people on the outpatients. That's double the size of the list anywhere else in the country. 1,213 are over a year, and of those, 371 people are there for over a year and a half. That's almost as high as every other list combined. There's clearly a Cork problem that needs to be dealt with in the interests of those women.
Thank you very much, Minister.
I want to thank Deputy Moynihan Ciancorla for raising this important matter. I understand from the data provided by the National Treatment Purchase Fund that at the end of June of this year, 3,859 patients were waiting for gynaecology outpatient appointments and 458 patients waiting for inpatient or day case gynaecology procedures at Cork University Hospital. While these figures represent a welcome reduction on the figures at the end of June of last year, there is, I absolutely believe, a need to address the issue of waiting lists in a much more focused manner. The Deputy will appreciate that ensuring timely access to health services is a key challenge. However, concerted efforts are and will continue to be made to improve the current situation. My department is engaging with the HSE regarding the development of an action plan for each hospital to address waiting times. Individual hospitals will be required to develop process improvement plans which will focus on improving chronological scheduling, validating waiting lists and ensuring that existing capacity is optimised and maximised, and I'm not sure that it always is, to be quite frank. The action plan will be implemented over the remainder of 2016. Within the HSE, a scheduled care governance group has been established to coordinate key initiatives to reduce waiting times and the number of patients awaiting treatment. I should also draw the Deputy's attention to the Programme for a Partnership Government, which commits to a minimum of €15 million funding for the NTPF in 2017. I know an issue his own party feels strongly about, to address waiting lists for those waiting the longest, as part of a continued investment of a minimum of €50 million per year to reduce waiting times. My department is currently engaging with the NTPF and the HSE to deliver on the programme's waiting list commitments. And in fact, I met with the CEO of the NTPF and the chairman of the NTPF in the last 2 or 3 weeks to put them on notice that they're very much being reactivated, that they should expect to receive a minimum of €15 million in budget 2017 to get on and do what they were doing a very good job at in terms of clearing long waiting lists, and indeed to ask their views and the HSE's views and the Department of Health's views in relation to how best to maximise the €50 million that will become available for waiting list initiatives. I'll look into the specific issues.
Minister, while these people are waiting on this massive list, it's seriously impacting on their quality of life, and it's very distressing, and the anxiety must be unimaginable for them. You refer to the Treatment Purchase Fund, which would put in place €15 million in 2017. This is 2016. Since the beginning of this year, the number of people in Cork who are waiting for over a year and a half for surgery has grown from 0 to 39. Those people, by the time the Treatment Purchase Fund will have come into place, that will almost certainly have grown and possibly even doubled. Minister, have you looked at the position about additional consultants? There have been no consultants appointed in the South-South-West group since the hospital was started 7 years ago, in spite of the fact that there are 28 advertised throughout the remainder of the country. The place with the largest waiting list and the most distressed women is left with no additional consultants.
Thank you very much,
Minister,
Deputy
have you also looked at the possibility of using the theatres that you have, the underused theatres where 4 were built and only 1 is being used for gynaecological services, while another one is vacant? This needs to be dealt with in the interests of these highly distressed people and their families and the people around them. They're our own
Thank
families.
you very much, Deputy Minister, to respond, please.
Thank you very much. I take the point Deputy Moynihan is making, and it's cold comfort to people waiting on waiting lists today to hear that the waiting list for this very procedure has fallen significantly in that hospital from June of this year to June of last year. There were 4,622 people waiting for this outpatient procedure in Cork University Hospital in June 2015. It's down to 3,859. It's still well too high, but it is a reduction. I have to acknowledge the work being done by the hospital in that regard. What people don't want from the Minister for Health, though, is tea and sympathy. What they want from me is action. And I've taken action. I have 4 specific actions in relation to waiting lists. 1, I've secured an additional €500 million for the health service. The overwhelming bulk of this will go to our acute hospitals, which will enable hospital managers in hospitals such as Cork University Hospital to do what they're well paid to do, which is to get on and manage and do some of the things that you're actually asking that they do. Secondly, I've put in place a small initiative this year with the remaining funds available to the NTPF. It is in terms of endoscopy. That's something we can do now. Thirdly, I've put the NTPF on notice that they're going to receive €15 million minimum in the budget in October. And fourthly, we have a commitment in the programme for government for at least €50 million for dedicated waiting list initiatives. We've got to tackle this, I agree with you, but I've got to be realistic in terms of what
Deputy Moynihan.
Gurmagat, and thank you for the outline of the actions that you are taking. Minister, in the meantime, and in the interests of these people highly distressed and languishing on waiting lists for far, far too long, there needs to be a clear path, and it's helpful what you've outlined. But the National Treatment Purchase Fund, is there some way of advancing that so that this year people will be able to enjoy the benefit of it and get off those waiting lists? The additional consultants, Minister, every other place in the country except South and South West, where the largest and the most distressed group of people is not after getting anything and doesn't seem to be coming down the tracks. Can you make further appointments? Can you make appointments and relieve the pressure there? The unused theatre, Minister, it should be available to relieve the distress, because right around the county there are people who are on waiting lists. It's really impacting their quality of life. Delayed diagnosis of cancers, for example, because they're waiting,
right, thank you,
and that's
Deputy.
seriously impacting their quality of life.
Minister, to conclude.
No, I take very seriously the points the Deputy makes, and it is very serious for people awaiting these procedures. And people are waiting too long, and that's why we do need to have a concerted efforts to tackle waiting lists. And that's why we all need to work together in this House, in the estimates process, to make sure we adequately resource our health service and adequately resource the NTPF as well as our hospitals to address these issues. I'll specifically raise with the hospital group CEO the issues that the Deputy raises in relation to the unused theatres and in relation to the consultant posts, and I'll pass on your comments in relation to that. I would also reiterate the fact, Deputy, that I have asked each hospital, every single hospital, to put in place an action plan for waiting lists. What are you going to do in your individual hospital between now and the end of this year to get on top of waiting lists? Because we can't have a situation where those of us in this Oireachtas last Thursday vote through 500 million, €500 million additional for the health service and see waiting lists continuing to rise. We need to make sure that when the money leaves the gates of Dáil Éireann, that money is spent absolutely in the interest of patients and some of the very important issues that you've highlighted.
Thank you, Minister. Question number 7 is in the name of Deputy Michael Moynihan.
I raised a question in relation to the substantial increase in the number of outpatients that are waiting for consultation within the Cork University Hospital. Is he aware of the almost explosion in waiting times for outpatients, and what are the plans outlined in relation to it? But maybe first of all he might outline to us, is he aware of them, and we'll tease through what can be done to try and reduce those figures.
Minister.
I want to thank Deputy Moynihan for introducing the question. question, and I am indeed aware, and have been made aware by you, that the number of patients waiting for over a year for an outpatient appointment in Cork University Hospital has increased since the end of last year. However, we obviously need to see these increases in the context of the overall increased demand for care and increased overall activity and productivity in our health system. In fact, it was brought to my attention only today that there's 13,500 more elective surgeries that have been carried out in the Irish health system this year than compared to last year. So we are seeing increased demand, increased activity, more procedures. But it is, of course, obviously a key challenge for us to ensure timely access to health services. I am assured by the hospital group that those patients whose clinical needs are most urgent are prioritised. The Deputy will be aware that improving waiting times for scheduled cares is a priority for the HSE, for my department and indeed for the whole of government. As I've already outlined to your colleague, the programme for a partnership government recognises the need for a sustained commitment to improving waiting times for a particular focus, for those waiting the longest. To that end, it does commit the €15 million funding for the NTPF for an initiative targeted at those waiting longest as part of a continued investment of €50 million per year to reduce waiting lists. And you know what? I think the policy of deactivating or effectively deactivating the NTPF was a mistake, and I think we're beginning to see the consequences of that now in terms of not having a ready-made vehicle that can intervene in some of the very particularly difficult situations you highlight. That's why we need to get it back up and running, and I think your party and mine do indeed agree on this. The HSE has established a scheduled care governance group to coordinate key initiatives to reduce waiting times and the number of patients awaiting treatment. My department is currently engaging with the HSE regarding, as I say, this development of an action plan, asking each and every hospital what more can you do to address waiting times to be rolled out over the remainder of 2016, conscious of the fact that for the first time in years the Director General of the HSE has said that he now has enough funding to deliver a service plan that's in front of him. Hospitals will be instructed to develop and implement process improvement plans focusing on improving chronological scheduling, clerical and administrative validation of waiting lists and the optimisation of existing capacity. And I expect this targeted approach, as well as the additional funding that we now have available, will be of help to CUH in addressing these current backlogs.
You will be aware, Minister, last week alone in relation to the Cork University Hospital, where there was very serious surgery, very life-threatening surgery had to be cancelled as a result of the bed crisis. And that's, synonymous with what's the crisis within the CUH. Everything is backed up. The first consultation is backed up. The second consultation is backed up. And when it comes to surgery, it's again backed up or stopped. Not alone just the Cork University Hospital, but right around the Cork region, the waiting times for the initial consultation has, in many instances, has exploded. And you've spoken there in relation to the HSE head saying that there was enough funding in relation to it. What is the Minister's thinking in relation to getting to grips with the waiting lists that are there for initial consultation, just specifically on that? When the letter goes in from the GP to the consultant and is looking for an appointment to meet that consultant in relation to whatever trauma, whatever illness that patient has, what is the Minister's direct plan of approach, or the Department's plan of approach, in conjunction with the HSE to make sure that patient is met in a timely fashion?
Minister.
No, thanks, Deputy Moynihan. You did indeed make me aware of the very difficult case, and indeed a very serious case in relation to somebody's surgery, which I've had investigated. I think the very honest answer to your question is, if you have a health system that loses 12,000 staff during the years of economic recession in this country, and we've now put back 6,000 of those 12,000 staff, but we needn't be patting ourselves on the back, because we still need at least another 6,000 to get us back to where we were before the financial collapse in this country. So continued investment in our public health service to make sure that there is adequate capacity in terms of staffing numbers, in terms of consultant posts, as your colleague mentioned, in terms of frontline staff, is absolutely the answer. What I'm saying, and that's in relation to the specific question you ask about ensuring that somebody receives the initial consultation. What I'm then saying is the next piece is, after they receive the initial consultation, if they need a procedure, how do we make sure that they can get the procedure done as quickly as possible? And I don't think now should be the time for ideological debate. It needs to be a time for pragmatism. If we have a vehicle like the NTPF that can assist and work alongside the public hospitals, I think that can move along that backlog as well. But I'm absolutely committed to continuing to increase the number of frontline staff, because that's why we're beginning to see, that's why we are seeing some of the delays, because we still need more frontline staff in our hospitals.
Deputy Moynihan.
Yeah, the initial consultation is the subject of what the bones of what the question I had down in relation to, and consequent on from that, what a necessary follow-up treatment or surgery or whatever, but the initial consultation, there were targets set in relation to waiting times. There was targets set in relation to by your predecessor and indeed your predecessor go back to in relation to that. Are those targets now, are they somewhere in the cloud, or are they real or imaginary targets, and are they targets that you're setting yourself, or are there higher targets that you're setting yourself to try and clear this list? But bear in mind, the initial answer to your question was, that was in terms of seriousness of the referrals, but there are many people that are very seriously ill waiting for referrals, waiting for initial consultations, and I don't be under any illusions that the most serious cases are getting to the front at the start. That's not the case.
Thank you. Minister, to conclude.
In relation to targets, 60% of patients, according to the NTBF's data, are waiting less than 6 months for the required outpatient appointment or for an inpatient day case procedure. 91% of patients currently wait less than the maximum waiting time of 15 months for inpatient or day case procedures, and 92% wait less than 15 months for outpatient appointments. But we need to continue to do better, but we need to not tie ourselves up in knots in relation to targets. We need to recognise that there's particular hospitals with particular backlogs, and what interventions can take place there on the ground with proper management, and that's the idea of the action plan. There's also another piece to this, though. Can we have some of these procedures take place outside of the hospital? And one of the initiatives that we're currently carrying out is an initiative to ensure that minor operations can be carried out by GPs in the primary care setting. There are currently 24 GPs participating in a programme which will see 10,000 minor operations redirected out of the hospital back into the primary care setting. Above and beyond that, there's also a diagnostic service, in particular the whole area of ultrasounds, where we have GPs at 10 sites nationally providing this. And you'll see a commitment in the programme for government to support people in purchasing more diagnostic equipment to keep people out of the hospital and out of the outpatients in the first place and back in primary care.
Question number 8 is in the name of Deputy Mick Wallace. Deputy Wallace, to introduce.
Thank you, Concordia. Minister, according to mental health reform, 75% of mental health difficulties arise before the age of 25. And almost 1 in 3 young people have at some time experienced mental health difficulties. Yet there's only 12 acute mental health inpatient beds for children in the whole south of the country of Ireland. These are in East Lynn in Cork. So a young person that may happen to experience some a mental health crisis in Wexford could have to travel 200 kilometres and mightn't even get a bed. I'm just wondering if the government intends to do anything about it.
Minister.
Thank you, and can I thank the Deputy for raising this issue. I think you're right, a lot of mental health problems arise at a very young age, sometimes a younger age than people like to talk about or to even admit. In relation to the inappropriate admissions, this is of course a very sensitive issue, but the reduction in number of children admitted to the adult psychiatric units continues to be a priority for the HSE mental health services, and it is indeed a priority for me. It's something that has been raised on a weekly and on a daily basis. Only last week I met with the HSE to specifically review progress on this issue to see what further improvements could be made in this regard. I'll be progressing with this with the Executive over the coming months, and in particular in the context of opening additional child and adolescent mental health beds, in enhancing our community-based care for the young people across regions, and then the additional mental health staffing while it comes on stream. I also intend to improve, where possible, the multidisciplinary approach at a local level to ensure that existing best practice is standardised nationally. Bearing that in mind, I think you have to see that we have made significant improvement in the last number of years. Back in 2008 we had 247 such admissions into the adult units. That number then declined to 89, and while we did see a short increase or a small increase last year, that number has a decrease and an increase this year. We are starting to see it move in the right direction. Also, I think if you look generally within the figures, where a child has been admitted to an adult psychiatric unit or an inpatient unit, the length of stay has been kept to an absolute minimum. The child is generally 17 to 18 years of age. While I'm not saying that's okay, while I'm not saying it's appropriate, I think we need to continue to put a variation of measures in place to see that those figures reduce. Our target is 95%. Obviously, I would like to see that get as high to 100% as possible.
Deputy Wallace.
Thank you, Concordia. Minister, as I'm sure you're aware, on the revision for change plan, the idea was the introduction of community.
Now, the next question is from Deputy John Brazel. You have 30 seconds to introduce your question.
Thank you, Chairman. Minister, the reason I raise this topic is recently I got contacted by my local GP regarding an 84-year-old man needing a cataract operation to continue caring for his wife who has Alzheimer's. He needs the operation done to regain retain his driving licence, and he's on a waiting list, and it's endless, and it's a continual problem. And the GP, along with many other GPs, have contacted me about this particular issue, and currently it would take 4 years to clear the waiting list that's there. Now, the services were transferred from Cork University Hospital to the South Infirmary, and the waiting lists have gone from bad to worse. And I would ask, Minister, that you address this particular issue, which has a huge impact on the people in the county of Kerry.
Thank you. Minister?
Thank you, Gael, and also thank Deputy Brazel for raising this important matter with me, and he has indeed brought it to my attention personally as well. A key challenge, as I've said to some of your colleagues, for the health service is to continue to ensure timely access to our health services, whilst also at the same time recognising that there's a constant increased demand on the health service. In that regard, I have been assured that the HSE seeks to ensure that those whose clinical needs are most urgent are prioritised accordingly, whilst the needs of others are assessed in terms of those waiting the longest. So if the case you talk about in terms of an 84-year-old gentleman, there should be, locally, clinically, people should be able to look at that situation and see the importance of that procedure. Improved waiting times for planned or scheduled care for all patients is a key priority for the HSE, for my department and for the government, and I won't repeat what I've said to some of your colleagues already in relation to our plans to reactivate the NTPF and our plans to put additional resources into dedicated waiting list initiatives, a minimum of €50 million in the budget due to be delivered in October. Only this week, my officials have been meeting with the NTPF and with the HSE to actually draw up terms of reference to make sure that we really are ready to roll as quickly as possible once Budget 2017 arrives. In relation to specifically your query regarding Kerry, I am advised that while there are 155 patients with Kerry addresses awaiting cataract procedures, that waiting list has reduced by 20% in the last 12 months. I'm also informed that the South West Hospital Group is developing a single ophthalmology service operating over 2 sites, as you've alluded to, as University Hospital Waterford and South Infirmary Victoria University Hospital Cork. The group, in addition to this, though, to particularly try and assist Kerry patients, is also exploring the introduction of an imaging system to enhance and streamline ophthalmology services for patients seen in Kerry. So I will ask that the relevant officials will look into the specific case if you provide me the details that you've raised here today. But in terms of the overall situation, we are seeing a reduction in the waiting list to the tune of about 20%, but I accept that there's clearly much more to be done.
Thank you, Minister. And I will bring you to your attention the specific case, because it is one that needs urgent attention. But I'd just like to give you some figures, Minister, because I know you're a man that likes to deal with fact. And the facts are that last year, in 2015, 680 patients were seen in the South Infirmary. Of those, 98 were from Kerry and 582 from Cork. Now, I don't want to get into turf wars here, but the figures speak for themselves. 14.4% of the patients were from Kerry, 85.6% were from Cork, which is basically 6 times. Now, the population of Kerry versus the population of Cork is 519,000 to 145,000, which is 3.5 times. If you want to go further into the demographics, the ageing population in Kerry is greater, so the need should be greater. But we're only looking for parity, Minister. Something is not adding up. If you're from Cork, you're getting seen quicker. The figures are there, the facts speak for themselves, and I would ask that you look into this, because we're just looking for parity of esteem.
Thank you, Deputy Minister.
Well, you'll understand if I don't get involved in the turf war either, your leader probably wouldn't appreciate me getting into a Cork versus Kerry spat, but the point you make is a very serious one in relation to ensuring that there's an equity of access to our health service. That's the entire idea, I suppose, between the hospital group structure, is that you don't just look at the local hospital or the local county, but you actually take a geographically wider view of it, and that is why obviously the South West Hospital Group has been established. As I've said, they are specifically looking at an additional imaging system which could be put in place to will both enhance and streamline ophthalmology services for the people of Kerry, and I think obviously there could be some benefit in relation to that. We have seen a significant reduction in that waiting list, but that is Cork and Kerry grouped together. I want to see a further reduction in these waiting lists, and that's why I intend to roll out a number of new waiting list initiatives shortly.
Do you want to make a further contribution on that?
Well, lastly,
quickly.
We're trying to improve services. The service was moved from one hospital to another, so maybe it would be worth just looking at has the reconfiguration of services actually resulted in a reduction of waiting time. And if it hasn't, then it should be. I think we have to hold departments to account, and I'm sure there was a lot of lobbying done to get this put into the one facility. It's there now, and we need to get it working. Just as a matter of interest, the National Treatment Purchase Fund, which you mentioned, is that not for inpatients only, or does it also apply for outpatients? And if it doesn't, maybe we could look at for that particular discipline to include it. Thank you.
Final reply from you, Minister.
Yeah, in relation to the first question, first part of your question, I'll do as you ask, and I'll have that looked at. In relation to the second part, I've had a very open conversation with the NTPF. I suppose the terms of reference for the NTPF are quite broad. It's there to carry out specific tasks as assigned to it by the Minister for Health of the day. So I have asked that we have a conversation about other areas where the NTPF feels that they can make a difference. Now, I'm very clear in my view on this, that the optimal situation we want to be getting to is where the Irish Public Health Service can meet the demands of Irish public patients. But I'm also acknowledging the fact that yourself, and indeed a number of your colleagues on this side of the House and a number of people on this side of the House, are constantly raising the fact that there are a number of acute cases where people are waiting extraordinarily long amounts of time for procedures, often relatively basic procedures, but that could make a major difference to their life. And if the NTPF is a useful and pragmatic way of addressing that, I'm very open to it, so I'll have the issue examined.
Thank you, Minister, for that reply. Thank you, Deputy Brazel, for your question. People put down the question, so Deputy Mick Barry, you have 30 seconds to introduce your question.
That means that Deputy Connolly will get in after me.
Yes, there will be time once we stick rigidly to the time that's here.
I will do, and I appreciate that. So it's to ask the Minister for Health for his views on the continuing depth of involvement of religious organisations in providing state-funded healthcare, on the separation of church and state, and if he'll make a statement on the matter.
Thank you, Deputy Minister.
I will indeed. Thank you, Deputy Barry. Voluntary and non-statutory service providers, including religious orders, have a very long history of providing health and personal social services in Ireland, and of course of receiving state funding to provide such a service. And I'd like to acknowledge the significant contribution of all such providers to the delivery of these essential services. And I remarked earlier in this House, were it not for some of those voluntary providers, one wonders how many of our people would have been cared for throughout the years in this country in terms of disability services, mental health services, and indeed others. The HSE, though, has a statutory responsibility, and you can't delegate that, for the management and delivery of health and personal social services. As well as providing services directly, the HSE enters into service agreements or arrangements with service providers to provide such services on its behalf. As Minister for Health, my priority is ensuring that all of the resources available to the HSE are used in the most beneficial, effective and efficient manner to improve, promote and protect the health and welfare of the Irish public. To that end, the HSE has a formal national governance framework which governs grant funding to all service providers under Sections 38 and Section 39 of the Health Act of 2004. This framework seeks to make sure that governance systems are sufficiently robust and effective to ensure that both the HSE and the grant-funded agencies, be they religious orders, irrespective of denomination, or other voluntary or non-statutory service providers, meet their respective obligations. This is the most critical issue for me, whether they're religious or not, is the service being provided that we, the taxpayer, through our health service are paying for. I do not have an ideological position on the involvement of religious organisations in the delivery of healthcare. I believe there is scope for diversity in the range of service providers delivering healthcare. That's always been the way in this country. But That service must be delivered, and let me be clear on this bit, Deputy Barry, in line with government health policy, in line with legislation, and absolutely in line with the responsibilities attached to the use of public funding. So once you're complying with our health policy, the government's policy, the legislation passed by this House, and the responsibilities attached to the money, whether you're religious or non-religious, isn't something that keeps me awake at night.
So the Minister is right in saying that there's a long history, but it's the 21st century now, Minister, and you say the key issue is the service being provided. So let's get down to the nitty-gritty on that. I'll quote to you from the Sunday Business Post of May the 9th. Catholic ethos restricting St Vincent's Hospital from procedures. Doctors working at St Vincent's Healthcare Group in Dublin are being restricted from carrying out procedures that are contrary to Catholic ethos, writes the Business Post. Gynecologists and urologists said they were not allowed to perform procedures such as vasectomies and tubal ligations for patients who want to permanently prevent pregnancy. The doctors contradicted assurances given by management, who had insisted that there were no restrictions stopping us doctors from performing these procedures. Doctors at the Mater Misericordiae University Hospital in Dublin City Centre said they faced the same restrictions. The Mater Hospital and St Vincent's receive €450 million in state funding between them each year. And John Thornhill, the President of the Irish Society of Urology, said vasectomies were, quote, not allowed in hospitals in the public sector with a Catholic ethos. Would the Minister care to comment on that?
Thank you, Deputy Minister.
As I said very clearly already, my responsibility as Minister for Health is to make sure that we're delivering the services that the Irish public require in terms of their health and well-being, and my responsibility is to ensure that funding that this House gives me to expend on the health service is dispersed by the HSE, either spent by them or dispersed to voluntary organisations, and that we get value for money and that we get the services that we pay for and the services that we require. I set health policy on behalf of the government. Nobody else, and no religious order sets health policy, and therefore I do feel very strongly, and I think I share Deputy Barry's view in relation to this, that where the HSE or the Irish taxpayer is funding a service, it's this House and this government that sets the policy, not any other House or any other type of governing body. There is obviously an issue of conscientious objection, and I think that may be what the Deputy is referring to, and this could potentially arise in the context of the provision of treatment and services in healthcare facilities run by religious organisations. The European Court of Justice has outlined that this conscientious objection remains a limited right derived from religious freedom that cannot lead to the restriction of the rights and freedoms of another person. However, a healthcare professional's conscientious objection absolutely does not absolve his or her duty of care to the patient. Therefore, he or she could not abandon the patient or cause the patient's care to suffer in situations where such a transfer would not be possible. And this is in line, Cahirlock, with the approach outlined in the Medical Council's Guide to Professional Conduct and Ethics, which facilitates the transfer of patient from one doctor to another.
Dedicated state-funded service with the specific remit of catering to homeless pregnant women has been provided by a so-called pro-life organisation, Life Pregnancy Care, which recently branded itself as a new and now claims to be multi-denominational. According to its audited financial statements for 2014 provided to the Companies Office in November 2015, its directors include Lorcan Price, who is also a director of the Pro-Life campaign. In 2014, the HSE gave a new Life Pregnancy Care nearly €500,000 in funding, 83% of a new's total budget. Would the Minister care to comment?
Thank you, Deputy. Quick reply, Minister.
I'll have to, the information that you've made available to me, Deputy Barry, I will have a look at and revert to you directly on. But let me say this. I met very recently with people involved in the TFMR group, Terminations for Medical Reasons, and we had a discussion about a number of issues in relation to ensuring a consistency in terms of access, particularly in relation to bereavement counselling and in relation to procedures. And I have undertaken in relation to the bereavement standards to make sure that phrases such as fatal fetal abnormality feature, as opposed to just phrases like life-limiting conditions. I'm very clear on this view. I don't care too much, to be quite frank, once the service is provided, who provides it, but I don't want any patient in this country to not be able to access a service that is in line with my policy as Minister for Health and the policy of this House and the Government.
Thank you very much, Minister. I'm going to move now to the final question today. Deputy Catherine Conley, you have 30 seconds to introduce.
Could the Minister confirm whether the promised review of the Vision for Change has begun, when it will be completed, the terms of reference, the composition of the review and so on, please?
Thank you, Deputy Minister.